If it is served in the hospital, then it must be healthier. Hi, this is Dr. Mura again. Thank you for watching. And if you would have following this quest of health that we embarked on, this is the myth number 7. If you would have missed the previous myths and talking about the health equation and how we define it, please go back and see be able to catch up. But today talk about the food that is served in the hospitals and even our schools. Often we think if the food is served in the hospital, then it might be great food. But actually, some hospitals, actually in overseas that they studied, they found that some of the hospitals, and that is not a normal common hospital, even the teaching hospitals, they found the food that is served in those hospitals were actually substandard. And not only that, you can think the teaching institution, what is happening there, and you find actually majority of the things that are fed in the hospital, it's the same thing that people are eating outside the hospital, which often predispose them to certain diseases. And high sugar, high salt, high animal content, high oil content, high fat content, and so on. And then the problem, the message that is communicated when a patient comes to the hospital and they are fed the same food that they've been eating at home, they somehow felt a little bit more at ease that actually this is the healthier food. But it's very bad. It's actually bad because this food often, totally, it's causing them to get sicker, and probably the disease, the lifestyle that they've been practicing out there, which predispose them to get sick. They come to the hospital still eating the same food, which can actually end up worsening their condition. I mean, there is some advancing, countries that are catching up with this. Things like, stopping selling fees in schools, and also some, institution of health, which coming up with a certain recommendation of things that can be done. But I don't know what have been your experience, but what we still have today, our hospitals are not that healthier. In fact, not only in the hospitals, just from medical school, those I remember the medical school that I went to. I mean, second and third year, I remember where the professor was teaching us nutrition. It was not a nutrition. It was more like that washed down in nutrition. But it should be outside with a cigarette smoking, and also drink a can of Coke. Now that gives you an idea what kind of nutrition education we were going to have thereafter. Even today, it's not really uncommon in the hospitals, even our medical schools, to find a professor and so who's highly educated. You would think in health, I would be tossing smoking and drinking. And the problem is these people, doctors in in certain higher education, the message that it communicates to patients, and the patient don't understand it, disconnect. I mean, that why then my doctor is smoking and I cannot smoke. I would have mentioned in previous videos how smoking, was actually prescribed by doctors in 1950s. But even after science coming out, it didn't change from 1950 until 1980s. That's where the hospitals started completely distancing themselves from smoking. But even today, there might be hospitals that can people find a place, security for patients, even for doctor to smoke. So if we serve in the hospital, does not necessarily mean it's healthy. We need to learn. We need to have this self-education, self-awareness to know what is really healthy for us. And that's how Dr. Mura comes in. We hope you continue this journey with us as we learn together, and as we change the situation in Africa. Together we can make Africa a healthier place. Leave a comment below, please, if you can, just what has been your experience in the hospital that you went to, and how is the food? How did you find food? Did it meet your health standard, and were you happy? It would be nice to know. Anyway, see you soon as we continue to explore this subject of health. Thank you so much for watching.